The one other thing I hear from people, and these are people who are not cancer patients, but I constantly get that post that says, what are you supposed to say to a cancer patient? Like, they never know how to, like, what can you do? How could you help? I always say, like, bake a lasagna, do something, like take a meal off their plate. Because when you go home, you don't always feel so great.
Right.
That's
Absolutely.
right.
Go over and say, I'll take your kids to a movie.
Just give me those 2 hours.
Just give them a couple of hours to like sleep and rest because you're just so incredibly
Tired.
fatigued.
Yeah.
That was the one thing that it was startling how fatigued you are.
I always like to tell people that I think, and I know if you've never had chemo, you can't even describe it. What that fatigue is like. That's the one thing patients come in and they say that shocks them is how
It's actually a bigger complaint on the list of side effects than nausea, believe it or not.
Yeah.
It is the number one side effect when you ask patients. It's their number one side effect.
Especially when you're normally a type A person.
and doing everything.
Because a lot of people can sort of fight through the nausea, or
But you can't fight through
you can't fight through the fatigue. It's fatigue from head to toe, and they just really just can't even get out of their own way. So it is difficult. So like you say, if they have small children, offer to take the kids or make a meal, or can I come over and do a load of laundry for you? I mean, I'd be happy.
And another thing I always say is try to be more normal, because there's this tendency to be a little morose. I knew that once I went public, my normal would never be the same. That every time somebody would say, "How are you doing? How are you feeling? Are you okay?" And you'd really kind of like life to remain normal.
Exactly.
And still go out to a movie, maybe even a funny movie to make you laugh.
Like, stop looking at me like so sad.
Yeah. I think too that now, as opposed to when we first started, it has become a whole different disease.
So wait a second. So talk about that. From the time when you first started
when we first
nursing.
started, there were certain diagnoses that were most certainly a death sentence. There was no question, and if you made it through that was like a miracle. Also, there were diagnoses that people could fight, and but you knew that you were only getting so much time out of it. And now it's amazing the amount of time people are living with their disease or being disease-free, and how long
become a chronic disease.
It's become a chronic disease,
like a diabetes or a high blood pressure.
Right. So when people say to you, "How are you?" I always think to myself, well, it's no different than the person who lives with diabetes or a heart condition. You have something that we're treating, and now we just have to watch you for forever.
But that is a huge, as you say, that's a 360. That's a complete change. And
absolutely.
I just sometimes thank God that I got my diagnosis of cancer at a time when we have the amazing medicine that we have, that they can get you through it.
The drugs have changed. There's so many new drugs that have come out, even in the last 10 years. Things that we've hung for the first time, and now we've, you wouldn't think twice, but we did clinical trials on drugs that are now first-line treatments. I mean, it's amazing the things that are out there now. And even the anti-nausea medicines have come so far. I mean, we really try very hard to have very little nausea. I mean, you may get mild nausea, but the drugs that we have nowadays really help people function fairly well, as opposed to years ago when they really just didn't have much. I mean,
and
they
I think
would
that's
they
the
would
point
be sick.
Of the whole thing is to help you live your life and function, and live with this, not be. You need to continue your life, whether you're going through treatment temporarily or somebody who's going to have treatment for the rest of their life, whatever it is.
And the more active I stayed and the more connected to my regular life I remained, the better I felt going through my treatment. That's probably one of the biggest tips, I think.
Yes.
You
And
just be a recluse and lay down and feel sick. You can feel as sick as you want.
When I do my initial teaching with patients, I will tell them a lot of the time, that's what I will say to them, like, don't let this, rule your life. You go out and you live your life as best as you can. If you feel like you want to, go walk 2 miles, then go walk 2 miles. If you feel that you can do it and you're not tired, do it. If you feel like you can go to work, go to work. I try to encourage people, go to work.
Yeah.
Do whatever, try and keep your life as normal as you can. It's really good for the mind.